All right, I think it's time we go ahead and get started to give our presenter enough time. I just want to go ahead and introduce myself. My name is Garcia Presame LeBlanc, working with ACOG and AIM, and I am going to be moderating this session for MLIC Symposium. You are, just in case to make sure that you are in the right session, you are in Charting the Course for Equity and Innovation in Maternal Health and Families in the Workplace. We have our presenter, Dr. Averjill Rookwood, and I want to make sure we give her the correct bio and introduction. So she is a passionate doula who is trained to serve in the holistic fertility, birth, and postpartum arenas. She also brings over 20 years of employer benefits management experience to the table to assist her clients behind the scenes with the business of family forming. Compassion, cultural awareness, education, advocacy are the pillars upon which she has built her business. Her company, The Corporate Doula, offers traditional doula services and modalities such as childbirth education, comfort measures training, acupressure, and evidence-based alternative care integration. The Corporate Doula signature service assists families with employer benefits in regard to decoding coverage options and maximizing the utilization of both employee and employer paid benefits. The Corporate Doula service is also available directly to employers and organizations to help a strategic approach to their family benefit offerings in order to attract and retain their desired workforce and equitably serve the communities in which they operate. Making a difference for families in birthing spaces and workplaces is the work that Averjill is honored to do every day. With that, I just want to go ahead and make sure that everyone is aware that this presentation is being recorded. And that you are more than welcome to ask questions, but we ask that you remain muted throughout the presentation, and you can feel free to use the chat function to ask questions, and I will be making sure that that chat function is clearly and frequently looked at. And at the end, should we have time, we will allow time for questions and answers. And with that, I will give Averjill the space to start presenting so she can have as much time as possible.
Thank you, everybody. And Garzi, just double checking, you can see my presentation, correct?
You're good to go.
All right. Thank you, everybody, for having me. I'm so excited to talk to you all today and hopefully share some insight on how maternal health, family forming, family sustaining is affected by policies and practices of the workplace, and talk about some innovations and some things that we can do to turn the tide in the right direction as we move forward. I would love if in the chat, just so I can know who I'm talking to, if you would put, if you are here kind of on an employer behalf, more from an organizational level, or if it's just strictly academic and informational, that too. And please feel free to ask questions throughout. Like Garzi said, I will take a look after the presentation, and then also open up the mic if we didn't get every question, if we got all those questions answers as well. Okay, so we're going to talk about just a quick introduction, ground ourselves on what is equity, some employee concerns, path forwards, and questions that people have. So first of all, what is the problem that we're discussing? What's the problem that is out there to solve? And really, it's that all of the issues concerning maternal health equity are compounded in the workplace. So there's already discrimination, racism, sexism at work that lurks in the background and quite frankly in the forefront as well for most. That's just out in the world as not a pregnant person. And then once you add a workplace to that, those stats that we all know by now for the maternal health, especially people of color and specifically Black women, that says things like we're 3 to 4 times more likely to die as a result of childbirth as compared to our white counterparts. Those stats are exacerbated. And when you add locality, that comes with its own specificities as well. That could be that 3 to 4 times more likely to have a bad maternal health outcome can move to double digits, 10 and 12%, if you slice it down to zip codes, area codes, municipalities, et cetera. But then also in the world of benefits, which we're going to lean a little bit more towards in this conversation today. But in the world of benefits, you know, things that are a deeper cut. So we think of health benefits as your health, dental, vision, et cetera, but leave of absence as it relates to maternity or parenthood comes into play. And things like living in a certain city, in a certain county line, those things may affect how your employer mandates that you take PTO time in conjunction with your leave time. And as we know, that can greatly affect how long you can be out, how long you can be out paid, and what your postpartum experience is like because of that. And so what do those employers do when we're talking about employers who function on the state level, regional level, national level even? How do they create equity amongst those people, for example, in Arizona, Illinois, who have municipality rules in regards to their PTO, for example's sake? So just so we're on the same page, we've been hearing a lot about equity throughout this entire symposium. And on a base level, what does that mean? So one of the definitions, according to Merriam-Webster, is justice according to natural law or right, specifically freedom from bias or favoritism. If we're talking about maternal health equity, it's very easy to draw the line there in terms of bias and favoritism. A little bit more, it's a little harder to draw the line in terms of life in the workplace, but it's quite easily explained by systems, processes. That bias, that favoritism, that is more embedded in things like company culture and things like the chain of command and who you have to go to whenever anything is you need to be out because of anything medically related, most specifically for the birth of a child or the expansion of a family. So that's just so we're on the same baseline in terms of how is equity defined? And then how do employers or organizations have the opportunity to enter a place of equity in the workplace? So first and foremost, vision and values, but those could be as old as time, never refreshed. So what are organizations doing? What are employers doing to kind of take look at that through a new lens? And I know we were going to say employer a lot, and organization, but as community health and public health leaders are called to the table more when it comes to commercial health, so healthcare carriers, et cetera, what does that conversation look like? And this is a great place to start in terms of making sure everybody's on the same page in terms of what's the vision? Where do we want things to go in terms of equity? Next up is policy and permission, and we're going to talk a lot more about that. Policy, of course, is the rules that someone in the workforce has to abide by. That could be local, state, federal, but it also could be rules and policies, a protocol that's specific to that company as an employee. But permission, again, we'll talk about, is a big thing because you can have all these things in place, but you're scared to take it. So how does that affect that pregnant person? How does that affect their health outcome if they don't feel they have, quote unquote, permission to utilize the resources that are allotted to them? And the most common way that we can affect that the health equity for maternal health specifically is in the workplace is benefits and programming. So again, benefits has a broad scope, and we'll talk about some of the ones that we won't get to delve too deep in today, but to kind of illustrate how broad benefits can be defined, and programs, again, either connected to the benefits or more of a standalone. But for me, communications is a big thing. How something is communicated in terms of the resources that are available, who it's communicated to, and when it's communicated to them. All super important. So, I mean, we work outside of the intrinsic desire to feel fulfilled and working towards purpose. We work because we need pay and benefits. So pay and promotion is extremely important, because not just in affording whatever acute care might be necessary as a result of childbirth, but prenatal care is grossly affected by not only what someone can concretely afford, but what they perceive they can afford. So sometimes it's about changing minds and making things more accessible. And again, that communication, communicating that these things are available, because you'll often have not just employees, just birthing people in general, say things like, I can't afford that, or that's not for me. This type of benefit is for them, not us. So one thing that comes to mind quickly, also a little biased because I am a doula, is doula care, for example. There are many ways to gain access to a doula. You might have to do a little bit of gymnastics to do that in the workplace, but absolutely possible. In the workplace, more times than not, you have parents who are pitted against non-parents, and what that means in terms of availability, what that means in terms of dedication, what that means in terms of promotion again. And that is certainly coming from an inequitable place. Gender, the fluidity and the span of it in today's workplace, and all the accommodations that come with all of the above, are all common areas of opportunity for employers and organizations to focus in on. So I like to get this out of the way, because no matter who you talk to in the workforce, if they are connected to finances in any way, if they're connected to program in any way, if we're talking about board of directors, if we're talking about C-suite, everybody else wants to know, well, who's funding this? How's this going to get paid? Where is this money going to come from? But I always like to say, we're never in the business that we think that we're in. These organizations that we work for or associated with, employed by, whatever service that they are offering or product that they're selling, no matter how small or how much, you still need people to make that go. We're really, all of us, in the business of people. And if your people are not satisfied, if your people aren't cared for, if your people are not able to give you their very best as your organization and employer, then it's a loss all the way around. So to win the marketplace, you must first have to win the workplace. Take care of your people first, and then you can go about the rest of your business. So just want to start with employee concerns. You will notice that all of them are really steeped in stress. All of them are really helped by education, and all of them have access as something that is very integral to turn it around from negative to positive, or from a concern to a point that's an asset. So job security, when you're creating a family, that's important to you in a normal day, but this becomes incredibly important at that stage in someone's life. Connected to job security is financial stability. Something to call out is all of the financial related benefits that and advisement and programming that's available to organizations and employers that support these organizations as well. things like 401k, things like 529 plans for your children, these things become incredibly important. And for women in particular, there is a gross inequity in terms of how much money, how much time and effort is spent on gaining true financial stability. Men outperform women in retirement planning in the workplace by double in most industries. And that is not sustainable. And that is a point of stress. Benefit and compensation, again, outside of whatever intrinsic goals that you have, benefits and compensation is a concrete reason why people work. Time management, how are you gonna be this parent? How are you going to be a top performer like you want to be? And then what's the cultural and mission match? So back to what we spoke about earlier, the values, time to dust those off, maybe look at them from a new lens, because if these things are not in place, if employees don't feel like these things are a concern of their employer or organizations, then you're gonna have less of a workforce. I think we would be foolish not to talk about the particulars of the environment that we are in now. One of those things being COVID-19 and how that has affected maternal health as it relates to the workforce. So there are increased responsibilities. Now much of children are going back to school in the physical sense, but still by and large, home responsibilities have increased 40 to 80%. How could that even be a real number? Like, do you have 80% more to give in your day? That's a lot, but that's what parents are being asked to do just in keeping their households afloat. And what does that do to your behavioral health? What does that do to your overall wellness with that much more on you? And what are employers and organizations doing to address that, to realize that and address that? Because if you think this is not, if they think that this is not having a strong impact on the health of their employees who are starting families, that's a gross miscalculation. And 1 in 5 working parents are considering leaving or have left the workforce to care for their children. That imbalance still has not been solved. Again, it's both parents, regardless of gender identification. However, statistics do show that those that identify as women are far more impacted than those who identify as men, for example. But to that point, there's a lot of role fluidity and gender fluidity that's affecting childcare and what role each parent plays. And is there room for that in policies, procedures, resources in the workplace? What effect do those things have on family forming in the workplace? So the point of this is to say, that 30 million number is one that no one could put their fingers on truly because it's upticking all the time. But the point of that is that most people who are uninsured are working and part of a family. Unfortunately, low income. So again, what resources they're working, spending all their time with whom they're ever employed with, but what does that pay off? How does that pay off in terms of benefit options? When there's an acute situation with a birth, can they afford that copay? Are benefits being designed for the lowest of pay in mind, not just the highest or not just the mid kind of range? And we see that more than half of those who are employed, we depend on our jobs to employ us. So we're kind of at the mercy of how in depth, how frankly gracious sometimes they want, employers want to be and organizations want to be, and how benefits are designed to assist us in that time of life. I'm not sure if you all can see this, but overall what it depicts is single coverage versus those who have family coverage in the workplace. And those who have single coverage have less of a financial responsibility, regardless of the size of the organization that they work for, the employer that they work for. If you have family coverage, you are wearing more of that cost. So again, has this been, what are employers going to do about that? And what effect does this level of stress, does this level of benefit coverage have on outcomes and the equity of these outcomes? Because if we take a deeper cut, we would see that in some states, it's rural versus suburban versus metropolitan area. And sometimes it's very apparent by socioeconomic things such as income or location as to where we would see that people would suffer the most from the plan opportunities that they have to choose from. For example, there are many maternal health deserts. And so if you have a national employer, are they using their advisors to really understand where those deserts are and to put more pressure on the network that is available in those places? So if you only have 2 doctors to go to in a rural setting, what are the workarounds around that? There are only 2 OBGYNs. Or in a metropolitan setting, if you have to drive an hour and a half to have a birth center birth, is that feasible? What can be done coverage-wise about making that still accessible? Should the employee choose to travel that distance? Or would zip codes bump that out of being covered? And so now we have another issue of equity just in plan designs, all the details of plan designs. And these are the kind of inequities that are hidden per se, but vastly affect women overall greatly and women of color even more so. So this is how some policies come into play. And I'd love to know if there's anyone in the room who has say-so or sits at the table for policies. If you could let us know in the chat. Prenatal care and leave, that has to be something that is baked into policies from the very beginning. Equity has to be built in from the full spectrum of the experience, from fertility to postpartum. So an example of how inequities might lie in something like fertility in benefits for those who are not in a heterosexual relationship and past a certain age, you might not have access to fertility benefits. It isn't written as such, but certain indications in what is approvable and not approvable in those contracts kind of box you out of those opportunities. So if you are a younger woman who, let's say, affected, a young woman of color, most specifically Black, who we suffer or have more indications of PCOS, fibroids, and you might want to, you're in a situation where you may need to freeze your eggs because of issues that you're having reproductive-wise, because of your comorbid situations. Is that approvable? A lot of times there are loopholes and you are not. So why aren't employers releasing kind of all of the chokeholds around requirements around that? But that's how inadvertently a woman of color could be boxed out of that. Her age, her comorbid diagnosis, and sometimes where you are, what city, what state, municipality that you work in, and whether that was considered in the plan as your employer put this together for you. Leave and pregnancy benefits. There was a discussion earlier today when the symposium kicked off. Those partners who identify as male and fathers are grossly underutilizing any type of benefit that is for parental leave. So again, we haven't quite talked about permission yet, but what's the permission that is given to everyone in the organization, everyone who's employed by the company to take parental leave? As we know, postpartum is a time period that many things can come up and support is needed. So if you have a partner, but he or she is not able to take time off, not because the resources aren't there, but because of the perception of them, should they leave to take that time to support that person who just had the baby, there's issues with that. So now the birthing person is forced to travel that postpartum journey alone when the partner had full resources to assist. Again, how can we build equity into benefits, policies, practices? Return to work is an area that no one ever thinks of, but really the return to work equity begins before the employee ever goes out on a leave. First of all, is it communicated to that employee? All the options, paid and unpaid. There are so many local leaves or state leaves, and none of which are uniform right now. So is someone in your organization, or are there organizations out there for this person to reach out to get a better understanding of the full breadth of what's available to them for time off, not only directly after the child is born, but in the months following? And then once you return back to work, what are the resources that are available? So this is the last day of Black Breastfeeding Week, and lactation is a huge concern. If you don't feel that you have the permission, if you don't feel as a Black woman that you have the resources, if you don't feel it will look that you would be looked ill upon for taking the time out of your workday, your schedule to do this, this can affect your outcomes for not only the birthing person, but the child as well. So what are the lactation policies that are available that have been put into place at the employer? What are the organizations? Are there organizations that can assist employers with putting together lactation policies that are comprehensive enough, not only for those who are in a corporate environment, but think about those who work in a retail environment, who work in a customer service environment? How is that going to work? And then now with working from home, teleworking, and we're on meetings all day long. Can I turn off my camera? Can I step away from a 2-hour meeting for 20 minutes in order to pump? What does it say somewhere on paper to back me up, to give me some security for using this resource that's available to me? And regardless of the state or the federal rule or law that's in place, employers can also be more generous than that. So nothing's stopping you from going above and beyond as an employer. Nothing's stopping you as an organization who maybe advises or is a resource to suggest going above and beyond. So let's talk about, we've said permission a couple of times so far. So let's talk about, what do we actually mean by permission, or ways to give permission? For me, it's 3 main points. First of which, to take an all-level approach. So not just from the top up or the bottom up, it's from all directions. Make sure that communication is given to everyone. And if there's nothing else available in this day and age, in this age of data, is data, right? So we're able to splice information, sew together information to monitor utilization across all kinds of demographics. And it's going to be different for each setting, different for each organization. And that would be used to target communications. It's nothing that is identifiable. You get it from many places. So your employer has data on you, but then also anything you use as a third party. So if you have Cigna, if you have Blue Cross Blue Shield, if you have United, if you have Delta Dental, if you have whatever, they can all give data on there. Again, de-identified. So to understand how many C-sections, how many people out of said leave time, how many people are taking 50% of it, 75% of it, what state do those people work in, what department do those people work in, what's the income level of those who are taking 50% of that time versus 75 or 100% of that time. Are birthers taking that leave? Are partners taking that leave? So really use the data that's available to us and take action, make those results actionable. Another thing that we talked about this morning, is just when the men had their session was, just seeing something different. So for me, that looks like displaying diversity. So address issues of race, marital status, gender, more in visual representation. What does that mean? That means on anything that's produced, whether it be online, paper, in hand, hanging on a wall, in your mailbox, anything visual on the website, anything visual should have a broad, look at it differently for a broad scope of diversity. Because if you can see yourself in that visual representation, you might be more likely to perk up and say, well, maybe this is not them. Maybe this is for all of us. And something that is unique to employer spaces is the employee resource group. So parents, a parents group, a Black mothers group, Black fathers group. There are so many different variations of ERGs depending upon where you work. And encourage and equip them to be actual, real resources for those employees, whether that be setting up buddy programs, whether that be making sure that the leaders of those ERGs understand the referral to leave process or the referral to where to ask benefit questions, not taking on that responsibility themselves, but making sure they know where to kind of direct traffic, so to speak, so that real educated answers are available to those who have questions. And lastly, have intra-year updates. Why wait until we're used to annual enrollment coming up soon? So October, November, and whatever you choose then is going to lock in from January 2022 to the end of the year. For things outside of actual benefits, why not take a look at them every quarter or twice a year and see how it's working, who's using it, and make changes accordingly. And make sure that you publicize those changes. So there's a path forward for both 2021 and 2022. So right now, I think it's important that we pay attention. Employers and organizations, quite frankly, when it comes to benefits, work with consultants, advisors, whose whole job it is to know market trends and have access to really deep cut data. And so ask for them, number one, pay attention, see how that affects all the groups that are employed, that comprise the workforce. So whether that mean a multi-state approach, a multicultural approach, sometimes it's just a multi-city approach. but pay attention to what the trends are in last year's data, in this year's data so far, and ask. If you ask a parent, they will tell you. They will tell you what they need. They would tell you what they would like to have, and make informed decisions moving forward. So it won't look like it does today because we're trying to have forward progression, right? So we'll be forced to think outside the box. Benefits that didn't exist today, approaches that didn't exist yesterday, conversations that are not currently being had, looking at data that in a way that it's not being looked at. I like to tell people about the $1 million baby. One preemie baby can cost the company or the organization over $1 million in the first 3 days of life, and hundreds of thousands of dollars in the first 3 years of life. So where could that money have been saved? Where could that life possibly have been spared, whether we're talking about the birthing person or the baby, by implementing some programming that made sense? There's no one cookie cutter way of doing things. There are some high level things that most people should look at, but how it's embedded in your organization, how it's interwoven amongst everything else that you have, that's the key, that's the important part. And again, communicate. It's important to communicate all of these changes, all of the opportunities to make changes that are coming up. Scream them from the rooftops and explain them, not just say it's coming up, but it's, I believe, an employer's responsibility, not just in due diligence, but ethically, morally, to make sure that people have the tools to make informed decisions. As employees, we spend an incredible amount of money over our lifetimes on employee benefits. And for such an investment, people know so little about it when it's time to be utilized. And it's not just, again, what to do if something goes wrong and there's an acute care situation, but along the pathway, along the prenatal, along that entire journey, even if there is a loss in that journey, what resources can be used that you pay for, or that your employer pays for you, that's not being utilized. So that's the magnifying glass that needs to be taken to the approach for the rest of 2021 as we prep for 2022. And for 2022, we need to start now. If you haven't started, you're already late. But as the recipients of this care, of this potential care, it's important for us to tell our employers what we expect of them, what we would like of them, the things that are important to us. In those ERG groups, if you're so moved, share your experiences so that can then be bubbled up to those who make design changes. Because if something isn't handled for that experimental treatment or that emergent treatment, or that zip code, for example, those things need to be bubbled up so that they can be accounted for and taken into consideration when planning happens. Plan holistically. As we all know, birth is an all-encompassing thing. So it touches every aspect of an employee's life, affects everything about how they show up, both physically, but also mentally in the workplace as well. Bring everybody to the table. So this should never be done in a silo. This should never be done by administrators who are not having parents at the table, not having people of color at the table, not having looked at the data and find out, are there any problem areas, and serving those people specifically by inviting them to the table. And again, I can't say enough, communication, communication, communication. So opportunities for benefit innovation, right? Because we've talked about, some of the issues and how to address them, but by and large, what are the hot areas of innovation? Telehealth is one way that really equity can be gained regardless of geography. So in 2020 and 2021, we saw a huge uptick in telehealth utilization, but now it's time to take a deeper cut and see what was the quality of those interactions. How many interactions in order to get to the resolve or the result or to address the issue at hand. Those are the deeper responsibilities. And who's using those? Is it rural versus anyone else? Is everyone kind of using it? Or is no one using it because A, it's not properly advertised? Or is there bias that's happening as a result of telehealth, and people still don't feel like they're getting any quality time with their provider, even in a virtual setting? Have those conversations, ask for that feedback. EAP and behavioral health, like no time before, is also being utilized. But again, a deeper cut needs to be taken. Who's using that? What are the barriers that still exist in order to receive behavioral health? Who's receiving behavioral health? What is the employer doing to address any stigmas that might be serving as barriers to utilizing this benefit? Leave of absences, whether for any parent, how well has that been thought out? What is the utilization of it? Maternity wellness are programs that run the gamut from having a nurse. I would even loop in doula care to that as well. Currently, doula care is more of a private pay or a community service, not something that has been fully addressed by employers. And my guess is that it's not going to be able to go on for much longer. So having a robust maternity health program in regards to wellness, fertility, acute care, lactation support is a huge missed opportunity in the health and equity of maternal health that is not addressed on the other side of having that baby as a working person. If you are in industry and it's not just a nice room where someone can pump, it goes beyond that. It's scheduling. It's if you're in an industry that requires your employees to travel. Obviously, we're not traveling a lot right now, but are there shipping opportunities that are paid for? So I'll stop here to leave space for questions. I'll take a look. Okay, to see if there were any questions in the chat. It does not look like there are any right now. Garzi, are we able to invite anyone to unmute and ask questions if they have any?
Yeah, absolutely. Anyone who has a question, feel free to unmute yourselves and engage.
And I will stop sharing for a moment so I can see all of your faces, those who have shared screens. Okay, well, I think we're good and there might not be any questions. I thank you all for your time. And if there are any questions, I'm very easy to find and would love to interact with you and answer any questions at a later time.
Well, thank you so much, Averjill, for that amazing presentation. I can see a lot of people in the comments just saying what a wonderful presentation that was, and thank you so much for it. Just a reminder to everyone who joined the session that any handouts or will be distributed after the symposium, as well as sessions will be made available later on, and should be on the MLIC website within 2 weeks of the symposium being over. And so I think we have one question about how to join the mailing list.
Let me share one more time. If you just use your cell phone to take a picture of that QR code, it should lead you to the website, and then you should have a pop-up fairly soon after landing on the page that allows you to enter your email address to be on the mailing list. So we have lots of things coming up. It's the end of the year. There's lots of things that are going to be happening in terms of benefits. But then also, if you just want to reach out to me or keep abreast of what's happening, that's a good way to do that. So if you scan that QR code, just wait a second and a box should come up for you to enter your information.
All right, well, with that, just thank you again, Averjill, for that wonderful presentation. And like I said, just expect any news coming from MLIC within the next 2 weeks. So thank you all so much and have a great rest of your day.
Thanks, everyone.